Yo, yo, yo. Hey, guys, welcome back to another awesome edition of the Best Practices Show podcast. One of the cool things I get to do is I get to meet some heroes, some rock stars in dentistry that are truly transforming lives and doing some very cool stuff in this very noble profession of dentistry. Today, I interview one of them, Karen Raposa. You've got to watch this. She shares her story and how you can transform lives by treating patients with autism. It's a cool episode. Hope you guys enjoy it. We'll see you soon. Welcome back to the Best Practices Show podcast. Thanks for tuning in. What's really cool about this is I get to meet a lot of heroes, rock stars in dentistry that you may not know who they are. And I get to meet them and we get to share their stories and hopefully it improves your life. And today we're going to be talking about transforming lives and how you can do that with treating autism patients with Karen Raposa. So Karen, thanks for being on. I really appreciate you.
Thanks so much for having me.
Yeah. I want people to know your story. You know, in full transparency, you and I are meeting for the first time. My team said, you got to interview her. So I'm like, all right, let's do it. So tell us your story for somebody that's listening. Who is Karen Raposa? What do you do? How'd you get into this?
Well, so I'm a dental hygienist by trade, but I'm also a mom. So those two combined things really are where my journey started. So I had been in private practice for quite a long time. And when my third child was born, probably pretty early, we realized he was not developing well. And by the time he was 2 years old, he was diagnosed with autism, which is actually pretty young. The average age of diagnosis for children today is still about 5 or 6 years old. Okay. And I learned very quickly, I didn't learn much in my dental hygiene education about how to help someone with autism when they're in your dental chair. And I realized, okay, now I have to become an expert in autism and I know a little bit about dentistry. So I need to help the world of dentistry understand how they can help people like my son when they come for a dental visit. And, you know, when it comes to autism, if you've met one person with autism, that's it. You've met one person with autism. So there can be misconceptions that, I just do the same thing for everybody and it's going to help everybody who has autism. But every individual with autism is entirely different. My son happens to be significantly impaired, very little verbal ability, lots of aggressions sometimes, depending how frightened he is, some self-injurious things. I mean, he's really the patient that if you can have success with him, you can have success with any patient.
Yeah. What an important cause. This is awesome. I do want to ask you about that. What are some of, let's start with the big picture. What are some of the big misconceptions that you see when it comes to, and also we're going to talk about this later. You also have a book, you wrote a book, but let's start at the big level misconceptions.
So I think, unfortunately, a lot of it is because of the media. What the media tends to show is people who are higher functioning with autism, because there are people who maybe are not comfortable socially, but they're brilliant. They're savants and they can play instruments amazing, or they can, go through life when it comes to their education very easily. But it's a spectrum. And I think that's the misconception. People don't realize, what does that mean, spectrum? Well, it means that some people with autism may be extremely intelligent and some people may be severely impaired intellectually. And socially, some people may be able to communicate well and get along with others, and other people may not have that ability at all. And some may need someone to care for them for their entire life, and other people may be very independent. And I think the misconception is that it's just this one kind of image that you might have in your mind, and it can most of the time, individuals like my son, you don't hear about on TV programs or in the news, or unless something really bad happens.
Right, right. And talk about the importance of this in dentistry. You know, dentistry is an incredibly noble profession. It's awesome. And as we put these two together, if I'm a young dental student listening, like what should I know about this?
So in general, Kirk, most people go into dentistry because they want to help people.
Right.
What tends to happen with the autism population is most of the time a dentist, a hygienist, an assistant wants to help. They're just afraid they might do the wrong thing. And so instead of trying something, very often they choose not to help.
Right.
And people with autism are human beings and deserve that valuable, lifelong dental health just like everybody else does. But and I can understand. I didn't know anything about autism. I was a
Right.
hygienist prior to my son. I probably would have done the exact same thing and been, oh my goodness, I don't want to do something wrong. I don't want to and have this end up being a bad situation. So I'm just going to see if I can find another place for this patient to go.
Yeah.
And the reality is there really are not places for these individuals to go. Everybody needs to chip in and help a little bit to make a huge impact.
Yeah, and talk about that, the joy on the other side of making an impact. And really, this is the whole gist of the podcast episode is transforming lives. What happens on the other side when you embrace this incredible opportunity?
So can you imagine being someone who, you're working with this person, you've learned that this person doesn't speak to anybody. Imagine if they speak to you because they've learned how you value them. They've learned how much you care for them. I love the phrase, people don't care how much you know until they know how much you care.
Yeah.
So at the end of the day, as a dental professional, most of the time you're exhausted. Imagine how exhilarated you would feel if you helped someone who no one else was able to help, and you helped them feel better, not have to have major dental care because you're helping prevent major problems in their mouth. You can change somebody's life.
Right.
You can have a major impact on somebody's life by keeping them out of pain.
Yeah.
Right? Imagine being somebody who can't speak and you have a toothache.
Yeah.
And you're banging your face because you're trying to help somebody understand and you're suffering every day. As dental professionals, we can prevent that from happening to somebody.
Yeah, absolutely. So, and then talk about the care provided. Now, as you started to get involved with this cause and you investigated and started doing some research on the care that gets provided for autism, what can you share with us about what you learned in that whole process? And what we need to know.
What I learned historically was most of the time these individuals were sent to, even if they were adults, sent to a pediatric dentist because they could do some in-office sedation. And if they couldn't do it in office, they'd take them to the hospital and sedate them. And, I consider that a form of restraint.
Mm-hmm.
And that's really where the good news is dentistry is changing. There are some amazing organizations that are advocates for this population now. The American Academy of Developmental Medicine and Dentistry is the first one that comes to mind because they're dentists and developmental doctors who are working together to advocate to get these individuals care, to get them preventive care in a regular dental setting so it doesn't get to the point where they have to be sedated or restrained. Or, we talk about protective stabilization today, actually, because you are protecting that person. When you say restraint, that's when you're doing it because you don't have good intention. But
Right.
protecting and stabilizing someone so that they can have regular dental care and they can be healthy for their life is a totally different concept. And there's a lot of good conversation happening around that because there's risks in sending somebody to hospital to be fully sedated for dental care when you know that a lot of that could have been prevented by taking some simple steps to help that person.
Absolutely. And so as you started, and again, as you embarked on this cause, I'm guessing you didn't limit it just to autism when you talk about developmental disorders. There were other important people that were included in this cause. Can you talk about that?
You're absolutely right. So there's a lot of conversation around intellectual disability / developmental disability, ID/DD. And so we don't use the word, it used to be in a medical dictionaries, mental retardation, and we've moved away from that. We like to talk about what people's abilities are.
Right.
Everybody has different abilities. But anybody who has some type of intellectual impairment where they can't communicate well, I mean, just imagine living your life. And you know what? Every one of us, Kirk, is one step away
Right.
from impairment. I mean, I could have a stroke tomorrow. You could have a bad car accident tomorrow. Think about the way you would like to be treated if you couldn't communicate well anymore. And
Yeah.
that's really what it's all about.
Yeah. It's amazing, the stories in dentistry, meeting people that are just the heroes, unsung heroes. I've met the geriatric tooth fairy, people that actually provide dentistry. It's so cool. And all they talk about is the fulfillment on the other side. So let's say I'm a young practitioner and I'm listening and I'm 32 and I'm like, Karen, I totally understand. Like, how do I start this journey? Like on the education side, like help me take the first couple steps.
That's a great question. I think the first step is to get involved with an organization like AADMD, because you're going to be then surrounded by other dentists and doctors who are helping people in this population. You do need to go beyond your DMD or DDS generally, because you're going to need a little bit more skill set in working with people who have different impairments. So whether it's a GPR specialty or at least AAGD, a little bit of an advanced education is going to be really helpful, because in these cases, you're going to want to be good at the dentistry, but you got to know how to help that person in general. And if you're good at the dentistry, then you can concentrate on the other pieces of it a little bit more. And surrounding yourself by people who have taken this journey before you, and they're all going to have different paths, because there isn't a specialty in dentistry yet for patients who need this type of dental care. I believe it will come one day, and one day soon. In fact, there are some studies being done right now to see some feasibility studies to see if there would be something like that. But I have the privilege of talking very often in my full-time job with dental students. And when I speak to them, I actually have a course that I do on this topic. And I'm always, always blessed with emails or several students coming up afterwards saying, I want to do this.
Yeah.
This is what I want to do with my career. How do I do it?
Yeah.
So that would be my advice, is to get involved with those organizations and follow the people who are the pioneers and who've done it before you.
Yeah. And so when you do, dental schools have been very receptive to your education. That's just a great place to start. Those kids are so hungry for knowledge.
Yeah, and what's changing is, the ADA and the Americans Disabilities Act. So a lot of that is changing, because we used to be able to say, oh, I'm not capable in this dental office of providing that kind of care. And now there are laws that say you can't do that, right? So if you can't, then you have to follow up, find the right for this person, and make sure that that person is getting the care. You can't just send them away and say, can't help. There has to be some more management and follow up to make sure the person does get what they need. So we're moving in the right direction.
Yeah. And now, how many years have you been involved in this cause? Like, how many years in it?
My son is 22 years old, so
Okay.
I have been involved for 20 years, because he was 2 years old when he was diagnosed.
That's all.
So
Well,
been a dental hygienist longer than that, but I won't tell you how long, because then you'll probably know my age.
yeah, no, that's okay. That's good. I love to hear your story and put the pieces of your journey together. And so you ended up writing a book. Tell me like how that came together. What was your motivation? What was the opportunity to educate people? How did that come together? What's the book about? And give us the gist of that.
Yeah, so the title is Treating the Dental Patient with a Developmental Disability. And this really came as a result of the course that I was giving, because it literally took off. The very first time I gave it was for the Maryland Dental Hygienists Association, and people started talking. And we know, even back then was before social media, really.
Yeah.
I mean, maybe there was MySpace, I don't
Right.
know.
Oh,
But
God.
but it took off. And when I started getting all these requests to share this information, I realized, there must be a book about this. Maybe I could include it in my course and help people get further information.
Right.
So I started doing research, and it didn't exist. And I was at a dental meeting one day where Wiley Blackwell had a table, and I walked up to him. I said, "Where's your book on, how to treat people in dentistry who have different types of intellectual disabilities or developmental disabilities?" They literally said, "We need a book like that, but we haven't found anybody
Yeah.
who is able to kind of put that content together for us." So my question was, well, how do I submit a proposal? And then Dr. Steve Perlman, who has been a blessing in my life, he was at Boston University. He was teaching pediatric dentistry. He was my son's dentist for a little while. Steve knows everybody, everybody, everybody. And so I reached out to him and I said, "Look, you know all the people. I'm happy to edit the content and do the content that is applicable for a dental hygienist." And he was like, "Let's do this." And so we have contributing authors for that book in different chapters from all over the world. And I had the privilege of working with all of them to put the content together. And it's still on the bookshelves of a lot of schools, and residents will purchase and doctors will purchase, and really is really valuable content for the actual what to do piece of this whole story.
Yeah. And so if I'm listening right now, where can I find the book? Can I find it on Amazon, or where would I get it?
You can find it on Amazon, or you can find it on Wiley Blackwell Publishing on their website as well.
Awesome. And if you're listening and not taking notes, we're taking notes for you. So just flip down to the notes section and you'll see we're going to put a link in there right to Karen's book. And I'm going to encourage you to check it out. And you can go straight there. And so, Karen, any last thoughts you have or anything you'd want listeners to know about this journey and how they can better transform lives by getting involved in this great cause?
I just think you don't really know what you don't know, and you never know how you can impact a person's life in a major way. I know most all of your listeners went into dentistry to really want to help people. This is a major way that you can help someone. And if every dentist and dental hygienist in this country just decided, "I'm going to help one person who has a pretty significant intellectual impairment. I'm going to be an advocate for that one person." They may have no one else in their life who advocates for them. Imagine how you can change their life, and in that process, change your own.
I love it. I love it. Now I know why my team said, "You got to interview her. You are truly transforming lives." And you're making it happen. So great job. Thank you so much for being on today. So
I do it from the bottom of my heart for my son Tommy. So thank you for the opportunity.
Absolutely. So thank you guys. And thank you for being on, Karen. Stick around when we say goodbye to everybody else. But I'm just going to encourage you guys, please check out Karen's book. And I really appreciate you guys listening. This is just an important cause. And as you're going to find, if you're a young dentist, this is just an amazing, noble profession. It's so cool when you can meet great people and improve people's lives, and it makes your life better, just like Karen said. So until we see you guys next time, keep watching the Best Practices Show and keep transforming lives. You guys have a great day. We'll see you soon.